So hi guys, my name is Alan Flores. So I'm your student nurse for today. So I'm going to prepare or to do the respiratory assessment, which is to my patient. So I'm going to introduce myself to my patient. Hi ma'am, my name is Alan Flores. I'm your student nurse for today. So I'm going to explain the procedure to you to cooperate you and to understand what I'm going to do. And, and also I'm going to provide privacy for information. And I'm going to prepare all the equipments that we needed. This is the stethoscope and the pulse oximeter. But now I don't have an pulse oximeter so that I can use to feel the pulse in the hand of the patient. The next is I'm going to perform hand hygiene to prevent cross-contamination to my patient because I'm going to touch her and also I'm going to communicate with her. And then I'm going to provide all the things that we need in this procedure. So, are you okay with to our procedure? I'm going to show you the respiratory assessment. So the next is the normal respiratory rate, which is the 12 between 12 and 20 beats per minute. So I'm going to discuss the level breathing. So this is the level breathing. So the next is this method we can use to identify or notice the chest of the patients moving up and down, up and down. Then to this method, we identify the regular or irregular breathing of the patient. So if the regular she using her mouth to breathe, but the irregular is using the abdominal to pull that breathing, and also this irregular is not consistent to breathing normally of the patient. And the next is we need to check the respiratory rate of the patient. If you can see, we can use the respiratory rate as her normal text appearance because moving in and out of the chest of the patient. So let's see. So you can see we notice the respiratory rate of the patient. And also I don't have a pulse oximeter, so I use the normal methods of you getting the pulse rate of the patient. This is the method for 1 minute to take the pulse rate of the patient and also in the respiratory rate. So let's assume that I get the pulse rate of the patient and the normal pulse rate is 88 enough, and also for the respiratory rate is 99. You can also use this method as you can see respiratory rate and pulse rate. You can do the same procedure to identify these two factors. Okay. So the next techniques to identify the respiratory rate ay the respiratory assessment, which is this one. But you can also um, um, provide privacy or ask permission to the patient if you use this method. It's like this. I'm going to um, tap your back to identify the abnormalities or the normal in the normal breathing of your chest or the shoulders. If you can see, if she hard to breathe, the shoulder of the patient will be increase or up because of the abnormalities or the hard to breathe. And also, this kind of method is maybe used to assess the respiratory assessment. The next is I'm going to use the stethoscope. So first you need to check if it works or it works the stethoscope. And using stethoscope is it's locked or it's open. So to using these methods, so you need to place in this adipose tissue to identify easily the breathing or the heart sounds and the lung sounds of the patient. First, if you use this method, you need to ask permission again to the patient if she to our and also explain the procedure but because the patient doesn't know what you are going to do with the patient. So again, if you notice of the abnormal breathing of the patient, is you need to um, tell the physicians or the doctors to give the prescribed medication for the patient. And also, again, document the procedure and perform hand hygiene to prevent cross-contamination to the patient. And again, so the next procedure is the percussion. So to identify the posterior thorax of the reminiscence of the patient. So first tell the patient to bend her head. Okay. Can you please bend your head and cross your arms. Cross your arms. Thank you. So this procedure, this one is like. So, the posterior thorax, the renaissance of the patient is normal. So the next is the auscultation. So if you always auscultate the breath sound of the lung or heart sounds of the patient, if you use a stethoscope. But before that, we're going to auscultate the back of the patient. So okay. The next procedure is the part of the patient, which is the auscultation, to identify or the abnormalities of the heart sounds and the lung sounds of the patient using this method. So, so the heart sounds or the lung sounds of the patient is normal. So there's nothing wrong with that. There's nothing wrong. I think it's like I heard in the breathing of the patient. So this kind of method we will use for the respiratory assessment to identify all the abnormalities of breathing of the patient. So, so my name is Abdul. I am a student for today. So thank you.